We respectfully acknowledge that the Windsor Regional Hospital occupies the traditional, ancestral, and contemporary lands of the Niswi, Iskwandonwa, Anishinaabe, the Three Fires Confederacy, Ojibwe, Odawa, Potawatomi. We acknowledge the land and the surrounding waters for sustaining us, and we are committed to protecting and restoring these lands and waters from environmental degradation. Good afternoon, all. I will call the meeting to order at 5:02. Does anyone have a declaration of conflict of interest? If you do during the meeting, please raise it at that time. First item on the agenda is the approval of the previous minutes of January the 8th, 2026. May I have a mover, please? Paul, seconded by Genevieve. Any questions or comments on the minutes? All in favor? Opposed, if any? Motion carries. Takes us to the report of the President, CEO, CNE, and Chief of Staff.
Thank you, Mr. Chair. Matt, if you could just bring up my presentation, please. All right, next slide, please, Matt. So just a brief update on our respiratory season, our latest hospital data. So we're continuing to see promising downward trend in influenza cases. You can see the numbers there are significantly reduced from what we've been reporting to date. So we've, for the week of last week, we had 6 COVID, 4 influenza A, 1 B, and 4 RSV cases. And we're seeing the same trend provincially. So the respiratory virus indicators are low, influenza is low and lower than last week, COVID low and lower than last week, and RSV is moderate and a bit higher than last week. So promising trend, and hopefully in a few more weeks we'll be into the nicer weather, and some of these respiratory viruses will go away for the summer session. So next slide, please. So just again, just a plug on where you can get information on vaccination. Go to the We Choose site, and for pharmacy vaccination information, you can go to ontariohealth.ca. Next slide, please. So under strengthening processes that drive a proactive and inclusive culture of patient safety and quality of care, we were pleased to have our announcement this week about the $1.1 billion that's been invested provincially for the hospital to home program, and the almost $2 million that have been allocated to Windsor Regional Hospital for this fiscal year to support the hospital to home program, which we did launch actually back in October. So since inception, we've had 119 patients access this program, and we're expecting a total of 230 by the end of March. And then we'll be continuing that on into 26-27. So this program helps not only improve care for our patients being discharged, but it helps improve access and flow throughout the hospital by ensuring timely discharges, and reducing readmission rates and unplanned emergency department presentations. And we had our lovely Mr. and Mrs. Davis attended the presentation. They were one of the first patients and families that were assisted with this program when we launched it. And they did a great job articulating how much it meant to them to get Mrs. Davis home and back to an independent state. And certainly Mr. Davis, as her caregiver, was very eloquent in discussing what it meant to them. And that's why we do what we do, is to help patients and their families. So it was really nice to talk to them that day. Next slide, please. And of course, not to overshadow, we did have our major procurement milestone announcement for the Fancy Family Hospital on January 28th. So IO, in partnership with Windsor Regional and the MOH, announced the phased approach for delivering the project and issuing the RFQ to pre-qualify the construction teams that will compete to design, build, finance, and maintain the second and largest phase of the new hospital project. And of course, we're looking forward to shovels in the ground for our phase one, our education and admin building and parking garage and site infrastructure. So lots of excitement and certainly a very thankful to Premier Ford and our government for supporting this project and IO and all the work that our project team has done, not to mention everybody that's contributed to the work over the last many years, getting us to where we are today. Next slide, please. And then just coming up, and next week, we're going to be celebrating our annual dedicated years of service. So this year, we're going to be celebrating over 700 staff that have reached those 5-year increments. So we've got over 400 that will be celebrated that have worked at Windsor Regional from 5 to 15 years, 243 that have worked at Windsor Regional from 20 to 30 years, and we have 40 that have worked at Windsor Regional from 35 to 50 years. So I won't center out our 50-year employee, but well done and congratulations and thank you to all of our staff for their long-term commitment to the hospital. So it's a really exciting program to celebrate our staff's commitment to their community. So thank you. And with the next slide, I think I'm handing over to my colleague Nicole for her CNE report.
Hello, thank you. In regards to our strategic direction number 2, foster an inclusive culture of accountability and transparency, on November 3rd, Windsor Regional Hospital launched the Qualtrics electronic patient satisfaction survey program, enabling patients to provide feedback via email. This initiative has been part of a broader provincial effort with over 100 hospitals across Ontario adopting the platform. And since implementation, we have received over 1,300 completed surveys. So very good work. We can change to the next slide. So for strategic direction number 5, we launched our statement of commitment to the psychological health and safety on January 9th, reinforcing that the well-being of our employees and professional staff is essential to delivering exceptional patient care. This commitment outlines our plan to establish a psychological health and safety management system and emphasizes a proactive approach to preventing harm and promoting mental health awareness and supporting recovery. Wellness Advisory Committee will guide this work through strategic planning, regular needs assessments, and program oversight, recognizing that psychological health is a shared responsibility. Leaders will model safe behaviors while all team members contribute to a supportive environment. Through ongoing evaluation and staff feedback, we remain dedicated to ensuring that WRH is a workplace where everyone feels safe, supported, and empowered to thrive, and of course, an equitable workplace culture that establishes us as an employer of choice. Next slide, please. And as part of the ongoing commitment to fostering a healthy, supportive workplace culture, the leadership recently hosted a staff wellness event designed to promote awareness for the resources available as part of our wellness program. The event created a space for meaningful dialogue between staff and leadership with a focus on holistic well-being, emotional, financial, and professional. One highlight was our partnership with St. Clair College, which enabled the staff to access complimentary student-led wellness services such as manicures, pedicures, aesthetic support, and these offerings were well received and contributed to a positive, restorative atmosphere. And I'm not only the president of the hair club, I'm a member. I was able to enjoy some of these services myself, and it was a really great experience. So through our promotion of these new wellness services, the leadership also took an opportunity to reinforce awareness of ongoing initiatives such as the financial planning supports, the EAP program, and these resources remain central to our broader safety to ensure that the staff feel supported both inside and outside the workplace. You can see some pictures here from the event, and I also want to mention that this week we have EAP on site for drop-in counseling sessions as a commitment to the wellness and well-being of the workers at Windsor Regional. So we're very grateful for this opportunity and grateful to our staff as well. I think that's everything for our report, Mr. Chair.
Any questions or comments for Karen, Nicole, or Wasim? Great news on the announcement for the hospital. I know Brandon's on the call somewhere. I can't see him on my screen. Brandon, congratulations to you and your team for all of the work that you've done over the past few years to get us to this stage. So thank you very, very much. Next item on the agenda is the Schulich report. There's Dr. Jacobs.
Thank you very much. The time of year is when we welcome a lot of change. Our medical students are currently just finished interviewing for their fourth year matches. That just finished this last week, and they will know at the end of this month, beginning of next month, March 2nd, where they will be going for their residency. In Windsor, just to remind you all, we have a number of spots here that are full-time, 11 family medicine spots, which is an increase from our previous 10. So 11 is our new norm. We have 4 internal medicine spots and 4 psychiatry spots. We're very excited to welcome our new crop of residents in July, and we'll have some, hopefully at our next board meeting, we'll have an update for you on what our local results have been like. Our Awards of Excellence is going to be held this year on March the 25th. I am privy to the award winners. I'm quite excited to let them know in the end of this week, I believe, and hopefully see all of you there at our celebration to really look back on a successful year of education and really elevate those people who do so much to increase our educational initiatives here in the city. So March 25th is the event, and the announcement will come out shortly to let all the award winners know. And then the last thing is our admissions cycle has turnover once again. Interviews for medical school are happening over these next couple of weeks. And our Windsor cohort will remain at 46 students per year starting this September. And the overall medical school cohort remains at 190 as well. So a lot of excitement. And I think our students, for the most part, they see the end of the academic year and they're ready for a bit of a break. So we're happy to give it to them as well. Happy to take any questions, of course.
Any questions for Dr. Jacobs? Seeing none, thank you for your report, Dr. Jacobs. Next item on the agenda is Chris with the financial presentation.
Thank you, Mr. Chair. Matt, I hope you have that presentation ready, available. Thank you. Perfect. So for the results for this month, as of this month, if you can go to the next slide, you can see the net deficit after building amortization as of year-to-date December 2025 is about $18,211,000, which is $3.5 million better than the budget and an improvement since last month. So seeing some progress there. Hospital margin is negative $12 million, which is $3 million better than the plan as well. If you can go to the next slide, we'll go through some of those significant variances. Other recoveries, we see surpluses in retail pharmacies, the Mohawk MedBuy rebates, and investment revenue. Salaries and wages remain in a surplus of $672,000. The surplus has declined compared to November, so we're going to keep our eye on that. Benefits in a surplus of $1.8 million year to date. This is also a decline of that surplus. Medical staff fees, $4.4 million deficit, 4.3 in offsetting funding though from the emergency and NICU alternative funding and patient services revenue for diagnostic services. Med-surg supplies had a surplus of $529,000 and a decline compared to November year to date. We're seeing a surplus in perioperative program is offset by deficit in diagnostics, primarily in interventional radiology. Drugs, you're looking at about a little over $1 million surplus, which is declined from the previous month. And other supplies, 1.9, almost $2 million deficit. Unfortunately, no offsetting revenue here, but slight improvement. Again, the pressure points, contrast media, physician recruitment costs, building and equipment maintenance, patient transportation, and legal and consulting. Some suppliers of contrast media for MRI and CT closed their operations due to the holidays during Windsor Regional, requiring us to order from different suppliers. So we'll keep an eye and hopefully that will become a little better next month. If we can go to the next slide, again, we've been tracking the sick and overtime against our benchmarks. You can see for the month of December, unionized staff, the sick percentage at both campuses is above the target of 4.8 with both MET and OLET at 7.2. The overtime percentage at Met Campus is above the target of 4.4, and Oleta is 6.2 versus the target of 4.0. And so we're kind of holding our own in there. And I know the group is working hard to address any concerns there. If we can go to the final slide here for the month of December, we do look at the non-union staff as well. Sick time percentage is 2%. That's below the target of 2.2. And the overtime percentage is exactly on target at 0. So that is the financial presentation at this point, Mr. Chair. And within that, there is tab C, and I would like to move the operating results and the meetings from the Finance Audit and Resource Committee from January 26th.
May I have a seconder? Cynthia? Any questions or comments of Chris at this time? Seeing none, all in favor? Motion carries. Thank you, Chris.
Thank you.
Under item 8 is the correspondence and printed material, which is in tab D for your information. Some very, very good press coverage in the last month. And are there any member questions or comments or notices of motion you'd like to make? Seeing none, the date of our next regularly scheduled board meeting will be via Zoom. Perhaps Karen will let us come back in sometime. Maybe, well, she'll be gone the end of March, so
Yeah, then you can do whatever you like.
whatever we want. If I may have a motion to adjourn, please. Paul, seconded by Anna. All in favor? Motion carries. See you at the next meeting.